Hi, this is Dr. Farley, and welcome to my new website, Physician Directed Nutrients, Lab Testing, and Clean Living Products. I've been working on this for a long time frame, started when this whole COVID thing came in, and I decided that I really needed to get a lot done because at the first lockdowns, I was luckily an essential office, and I was in the position not to ever have to let any of my staff go. And I said, we're just going to get a bunch of things done. And we really worked hard on producing this all. And then since this whole process has moved on, many things have changed. This COVID hysteria, as I call it, continues to go on and on and on. And I think that, yes, it's real. Yes, there's people that have died from this, but I think that we need to understand what's happening here. I mean, and some of those things that I find amazing is that the entire emphasis is on washing your hands, wearing a mask, and staying away, social distancing. That's not a healthcare plan whatsoever. That does nothing to build the system. That does nothing to make you healthier. The message that should be going out is, how do we get healthy? The problem is we're not going to true healthcare providers. And if you don't go to a true healthcare provider, you're not getting healthcare. You're getting ways to manage not possibly getting the virus. Another thing I want to tell you also is, I hear people all the time, did you hear so-and-so got the virus and so-and-so got the virus? My answer is, well, everyone's going to get the virus. Everyone. It's just the reality of it. You're not going to be able to wash your hands, put on a mask, and stay away to not get this virus. It will move through society. This is normal, natural, and this is just going to happen. And the sad thing is, the people that are weak are going to succumb to the virus. So what should the message be? Not run scared, not be scared at all. In general, build the system. And this message is totally being lost. The 4 criteria, the people that have the highest risk are heart disease patients, obesity, diabetics, and respiratory problem patients. So in those categories, those are the exact same people that are the highest risk categories of dying in the United States anyway. So basically what we're seeing is our sick population of those people, which is about 2 million people a year, 2 million, they die first. Well, that's logical. That just makes sense. The sickest people are going to die first. Okay? It's sad, and we don't want to see anyone die, but that's just the reality of it. The sickest people are going to die first. The next thing what we should be saying is this: what could we do to go to those 4 categories? 2 million people a year, 2 million Americans a year die of those diseases. What could we do to influence that number, 2 million? What if we could cut it in half and save 1 million people a year? Okay, it would be dramatic. How about these numbers too? If we cut that number in half, we'd save 1 million people a year from dying from those diseases. And if we cut those numbers in half, we probably could say we'd cut the number of COVID cases in half. So we'd save 1 million people a year from lowering those diseases by actually addressing why they have those diseases and not just managing them with drugs that do nothing. Here's the thing, too, that I want to talk about drugs. Every time we take a drug, it increases your allostatic stress load. It puts pressure on the system. Now, if it lowers your cholesterol and it lowers your blood pressure and it lowers your blood sugar, it didn't do anything to make you healthier. It didn't do anything. And how do I know? Because these are the same people, 2 million people a year that die from following that system. And those same people are the highest category risk factors of dying from COVID. The entire thing doesn't make any sense. And yet I hear no one talking about, what are you putting in your mouth? What cleaning products do you have around? What environmental toxins may be messing with you? We're not talking about this at all. Another thing I want to chat about also is, how do we know whether we're healthy or not? How do we know? Guess what you hear? How you feel. Well, if you have decent weight and you're somewhat physically active, you say, I'm healthy. No, you're not. We have no idea unless we measure, okay? This is a bunch of hogwash that we're being shoveled, that somehow you can tell whether you're healthy or not based on how you feel. By the time you feel bad, you're almost dead. It's ridiculous. The concept is ridiculous. Drives me crazy. And yet I hear people that have gone to the cardiologist and they drop dead 5 days later. And people that go to their GP and say they're all good to go. I got my check. I've been to the OBGYN. I got my check. And yet we find out these major diseases. You know why? Because they're not doing very in-depth evaluations, laboratory testing. And by the way, there's no concept whatsoever from any of these doctors on how food influences your health. They have zero training. It's a total crime. You're getting low-level care. It is not health care. It is disease management. That's it. This is not health care. Health care says, let's measure function, which means we got to do a lot of tests, a lot of blood work, a lot of specialty blood work, and then from there you fix what you find. Drugs may manage a symptom, but they do not restore function. And if it does not restore function, it does not raise your health. Make sure you're clear on that. Okay? One last thing I want to talk about also. The number one cause of death in the U.S. is heart disease. And the number one patient to die of COVID are the heart disease patients. What are they all doing? Well, the story out there is that cholesterol is causing all heart disease. And yet we're going to then take these drugs called the statin-lowering drugs. And by taking those drugs, we're going to lower that cholesterol. And in turn, we're going to lower your risk of heart disease. That's the story. Guess what, though? It doesn't work. How do I know? About 600,000 people a year died of heart disease in the 1980s, continued on in the 90s, 2000s, 2020s, except in the 1980s, around 84, we discovered the statin drugs. In 86, the American Heart Association said we will eradicate heart disease in 2 years. And yet the numbers have not dropped at all. But yet everybody that has any little bit of a cholesterol issue, they're all on those medications. So they are the number one cause of death in the U.S., and they are the number one cause of death when COVID comes around to kill those people. So to me, I mean, results matter. Results matter. I mean, if all my patients, if I told you this is what's going to happen and everybody was getting sicker and sicker and sicker, and yet I'm still going to propagate the story, there must be something else causing heart disease. And the statin drugs must not correct it because the numbers haven't gone down. It's really ridiculous. By the way, what we do know about statins is if they do anything, it's not the lipid-lowering, cholesterol-lowering benefit. It's that they're a quasi-anti-inflammatory. And there is some truth to lowering inflammation, and it doesn't mean you should use a statin or some other kind of anti-inflammatory. You got to go after how inflammation starts in the body, and that's another whole story. So the point of this is to let you know that true healthcare doctors and providers understand physiology and work from physiology. And if you go to a healthcare provider that doesn't look healthy, leave. If you go to a dentist that has no teeth, leave. If you go to an aerobics instructor that's out of shape, leave. It doesn't make any sense to me. So you got to practice what you preach. And hopefully you're walking the talk as a health care provider. Are you healthy yourself? Are you taking care of yourself? How's your family? I can tell you that some of the doctors I know, the sickest people I know, are their family members. Doesn't make sense to me. So, in this site here, what you're going to see is that we are distributors of healthcare. We distribute products, knowledge, clean living products, so that you can actually have a real healthcare plan and no longer be cowering in the hysteria of any virus that may be around now or may come around in the future. You're not following these genetic theory of diseases, which is not shown to be scientific whatsoever. And this is evidence-based programs. So we can back up everything that we tell you, everything. So from food to immune, to the endocrine system, to the immune system, to the brain, to moods, to thyroid, to Parkinson's, whatever it is that we're talking about, there's reasons and science to support what it is that I'm saying. I'm going to be making another video on the true benefits of the vaccines that are coming out, because we're being told that the vaccines are going to come and save everybody. And the numbers that they're using are that there's a 90 to a 95% effective rate. And I just wanted to chat about that for a minute because I think that we all should understand what that means. And what it sounds like is if I get that shot, I'm lowering my risk by 90 to 95%. But that's not what it means. Now, let me get my little notes here because I made these all up, and I'll share to you what it actually means. Okay, so here we go. So the study that I looked at had 44,000 patients in it, 22,000 in the placebo group, 22,000 in the treatment group who got the shot. Okay? So, of those people, they measured how many of them actually got COVID. How many do you think got COVID? 44,000 people. 170. That's it, 170. So if I take 170 and I divide it by 44,000, the risk of this group, 44,000 people, was 0.0038% of actually getting COVID. That's it. I'm not sure why there's hysteria. How many cases became severe? 10. If I take 10 and I divide it by 44,000, that's 0.00022% became serious cases and severe cases. That's it. Now, I want to talk about how we got to this 90 or 95% that you hear being touted out there. And they say effective rate. What does that mean? There's two numbers you want to know. Clinically effective and statistically effective. This is, in my mind, a complete unclear message that's going out about this topic specifically, but on most of the drugs that go out, on the real benefit of these. So clinical rate means if this is a clinically effective rate, it would mean that 90 to 95% of the patients are not getting this, right? And now if that's true, you may be swayed to say, hey, I want to go get that. And I may go get it. That's not what the number means, though. So what does the number mean? Let's break it down for you. So we just talked about 170 cases. Your risk of getting it is 0.0038%. 10 cases became severe. Your risk of getting a severe case is 0.00022%. By the way, this is all less than 1% clinically, okay? Now, in the control group, the placebo group, 162 people of the 170 total got the COVID. So we take 162, I divide it by 22,000. What's the risk in the placebo group if you did not get the shot of getting the COVID? 0.0073%. Still way less than 1%. 0.0073% of getting COVID if you did not get the shot and you were in the placebo group. If you got the shot, 8 people got it. 162 and 8 equals the total people 170. So if I divide 8 by 22,000, if you got the shot, your risk drops to 0.00036%. So where do we get 95%? All of this is less than 1%. But hang on, here's where it comes. We take the number, and we divide them. And if we divide those numbers, the 0.00036% divided by the 0.0072%, we get 5%, which means that we have a 95% statistically effective rate. That's what it means, okay? That's the benefit of this. That's the benefit of this. Clinically effective rate, less than 1%. Statistically effective rate, 95%. So we're sitting around not talking about how to get truly healthy and going to true healthcare providers, and we're putting masks on and washing our hands and staying away from the people we love and destroying businesses and waiting for this vaccine that has a 95% statistically effective rate and less than a 1% clinically effective rate? I mean, I don't know. Sure sounds a bit fishy to me. I'll let you be that judge. But now you have some information, and now you have some understanding. And what really has to happen is you have to understand that true health care means proper function, and you only know if you have proper function is if you measure it. Diagnostic testing that we run here, laboratory testing, specialty blood work testing to determine proper function. Then we determine health or not, and then we determine what to do about that to get the person to have higher levels of health. We must take our health care back into our own responsibility and recognizing that you have to become your doctor, I have to become my doctor, and we have to find people that are credible, science evidence-based, physiology-based providers. That's where true health care lies. So if you have any questions, let me know. You're going to see 4 action buttons. A webinar on neurobiomedicine, biomedicine products, a webinar on clean living products, or byproducts on clean living products. So you can click on any of those buttons, whatever you want to do. You also, if you click on one of those, also we can get you on to receiving our blog. And hopefully you found this interesting. There'll be more to come. And I hope that we lower the hysteria, lower the fear, get back to a reasonable approach. Let's talk about how our bodies and our minds work and what we can do to make them work better. And just like we cannot control the sun coming up and the sun going down, we can't control the tides, we can't control the seasons, we can't control the hurricanes. You cannot control viruses that will move through society. All you can control is you, and whether you build your system enough and your family system enough to stay healthy, to manage and adapt to any of those viruses that may come in over time, because this won't be the end. This will happen again. So the key here is don't be held together with tape and toothpicks. Don't be on the edge with your health. Take care of it, invest in it, and prioritize it. And then we would get out of this, and America would get back on track, and we would allow people to go back to work, and we would allow the hysteria to go down, and we would remove the fear, and we would put the responsibility back into the Americans' hands that you are ultimately responsible for your health, and you are ultimately in charge of what happens with that. And in turn, you are responsible and can take your health into your own hands and regain your certainty that you have a plan that will ensure your health and your family's health now and forever. Thanks. Have a great day, and God bless.